Hello Lana, welcome to this session where we will be looking at the practice of HBC, and basically what we'll be looking at it is what are the things that we do in HBC. So number one, we do assessment and planning, and in assessment and planning, make sure that you do a thorough evaluation of the patient's medical history. So you compare the past medical history of this patient and the current situation. So by doing that, it will help you to come up with a comprehensive care plan which will help you to address the specific needs of this patient. And then number two, we have different types of services. Number one, we have the medical services. These are maybe, for example, administration of medication. You also have personal care services. These basically you help the patient with daily activities, maybe bathing, cooking, and so on and so forth. You also have rehabilitation services. Rehabilitation services or therapy services. You help the patient, maybe the patient has undergone some injuries, so you help the patient to come back to their normal state. And then another one, we have support services. Support services cuts across both to the patient and also to the caregivers, or even to the family and friends. And example of the support services is counseling sessions. And then another key component, we have monitoring and evaluation. Now, under the monitoring and evaluation, we do track the progress of this patient, and you also ensure that you assign or you give follow-up visits of these particular patient. And when you visit this patient, make sure that you record the accurate details, or the accurate details about the patient. Maybe the patient has undergone some side effect, or maybe basically you just document everything about the patient. And then another component, we have training and education. In training and education, we train the caregivers, or we train the family members on how maybe to use some machines, or maybe how to administer some medicines to the patients. And then the last but not the least, you also have ethical consideration. So make sure when you are practicing the HBC, or when you are delivering services concerning the HBC, you consider, or you check on your ethics. Number one, informed consent. Make sure that every time you allow the patient to make decisions. And also another one, confidentiality. Always make sure that you observe confidentiality. You don't just share information, the information with anyone. And basically make sure that you observe the key principles of the patient. Bye, and see you in the next module.